Parik. He's going to give us It's All Heart, Approach to the Active Individual with Coronary Artery Disease. He has a little bit of bipolar training, University of Florida and Florida State. We'll see where his heart lies. And after that, he went to a neutral site, Mayo, for internal medicine and cardiovascular, sometime in Rochester too, or 6 months in Rochester as well. Please welcome Dr. Parik.
Approach to the active individual with coronary artery disease. So we all know that coronary heart disease is a bad actor. It's the most common type of heart disease, killing over 370,000 people annually. Every year, 750,000 Americans have a heart attack. 500,000 have their first heart attack, and about 200,000 are repeat customers. Coronary disease is the predominant cause of exercise-related cardiovascular events in adults. So in our younger population, you're going to hear about screening for congenital abnormalities and other things, but in our older adults, it tends to be coronary disease. Now, I don't have to tell this audience again about all the benefits of exercise, even in patients with coronary disease. There are systemic benefits like improvement in muscle tone and vascular tone, improvement in blood sugar control, higher aerobic capacity, less blood pressure and cholesterol, lower inflammation. But there's cardiac benefits too, improved cardiac output, stroke volume, and then improvement in myocardial blood flow, both macrovascular flow and microvascular flow. Most of my patients know that too, but they're surprised to learn when I tell them that exercise actually has a stronger connection to their life expectancy going forward than PCI, than stenting. So my patients in the hospital who've suffered their heart attack, I'll walk in and I'll say, what you do with your lifestyle going forward is going to determine whether you're alive or dead in the next 10 years, much more than the stent that we may or may not provide to you. And there's good data for that. This is one study that took 100 folks with stable ischemic heart disease, documented coronary stenoses over 70%, and actually randomized them to half getting a stent and half doing exercise training. And the folks who actually did the exercise training without the stent had lower incidence of heart attack, stroke, and hospitalization over 1 year than the folks who actually got the stent. Now, there is some risk to exercise with folks who have coronary disease. We know that exercise in general is